Hello, I'm Scott Haga, a physician assistant at the Spectrum Health Medical Group Center for Integrative Medicine, and today we will be talking about substance use disorders. Often, when we think about addiction, we make value judgments, but it's very important to remember that addiction is a brain disorder, much like depression or bipolar disorder. The definition, as stated by the American Society of Addiction Medicine, is that addiction is a primary chronic disease of the brain, primarily involved with reward, motivation, memory, and the related circuitry. So basically, we have to think of addiction as a brain disorder involving the reward circuitry of the brain. So why is addiction something that's important for us to consider in primary care? Well, it's very prevalent. Studies have shown that if we look at the average primary care population, about 30% of men and 15% of women have had an episode of binge drinking in the last month. And about 10% of men and 3% of women will admit to having heavy alcohol use in the past month. So about 1 out of 10 of the male patients that you see in an average day meet criteria for an alcohol use disorder. Statistics from 2016 show that about 19 million adults in the U.S. meet criteria for a substance use disorder. This is in comparison to about 44 million who have another mental health diagnosis, and about 8 million have a co-occurring mental health and substance abuse disorder. So these are very large numbers, and these patients are in our patient populations that we see on a daily basis. Data from 2013 shows that about 1 in 10 patients will admit to or have a positive urine drug screen for using illicit drugs. And you can see that the highest percentage of those are people using marijuana. But the second highest is prescription drugs, which are the substances that we're prescribing in primary care typically. So about 3% of a random sample of primary care patients had misused prescription drugs in the previous month. So let's talk a little bit about addiction. In order to survive, humans need 3 things: food, water, and dopamine. And when we get done today, if you remember nothing else, I hope you remember that dopamine is the underpinning of addiction. So in order to survive, obviously we understand food and water, but dopamine is the neurochemical that is responsible in our brain for pleasure or reward. And this is the hormone that allows us to feel the drive to do the things we need to do. So if we don't have dopamine, we don't have the drive to get food or to get water. So we'll die. And we know from animal studies that animals that are deprived of dopamine do in fact die 100% of the time. So this diagram of the brain is something that obviously we could spend a long time talking about. But if you go back to your neuroanatomy, you'll remember that the brain really has 3 portions. We have the brain stem, which is important for the basic functions of the human. Then the midbrain, which is responsible for sort of the reptilian brain or the animal brain and allows us to do the very basic functions. And then at the very top is the cortex, which makes us unique as primates and as humans. And this is the thinking part of the brain. So in addiction, we're dealing with the midbrain, and particularly the ventral tegmental area and the substantia nigra, and particularly the nucleus accumbens, which is in the midbrain. And in these areas, when a substance is used, such as opiates or cocaine, there's a huge release of dopamine. So if you think about the best day of your life being a hypothetical dopamine unit of 100, so that's the best day you can imagine. Well, if somebody uses an opiate, they will have a release of 600 dopamine units. So 6 times as much dopamine is released from the midbrain as on that best day ever. So you can begin to understand how this dopamine, which then triggers other areas of the brain, and you can see from this slide that there are pathways that go up to the cortex and are sending reward signals to tell your brain, we really like this. We want more of this dopamine. Whatever you just did, we want to have that happen again. So your brain encodes all of the things that are going on around you. What are the visual cues? What's happening when you do this? What can you feel? What do you smell? And all of those cues are integrated into your brain and into your memory of that experience that resulted in such a high amount of dopamine being released. And this is very important because those same things can later come back to be cues for the individual to use the substance again. And one might ask, so you've got this reward from the substance, why would you want to use again? Well, unfortunately, while the brain normally is producing, say, 75 to 100 units of dopamine, it got that huge bump to 600 to 800, and now that begins falling down again. And if you're using the substance repeatedly, the brain will actually become dopamine depleted. So instead of being at 75 or 100, now the brain is at 25. And the individual is in survival mode. They're trying to do whatever they need to in order to get that substance or that event that allows the dopamine to be released again. And this is what motivates someone to then go back and use the substance again. So those cues that we talked about earlier, the visual cues, the auditory cues, smells, everything that the brain associates with that use are now integrated and are now the things that the person is seeking out and will do just about anything in order to get that dopamine bump again to feel normal. So it's not a matter of necessarily wanting to get high. It's a matter of wanting to feel normal. And we often talk about chasing your tail, and that's really what's happening in this addiction, that the individual needs to use the substance in order to feel normal again. So as we just talked about, the cues are registered and acted on by the primal areas of the brain. This isn't even something that somebody's thinking about. It's done unconsciously and set in motion by the nucleus accumbens in the limbic system and is an enormous motivator to make us go and reuse substances in order to get that dopamine again, and is often strong enough that it overrides negative consequences. So while we're sitting thinking, why would I ever use a dirty needle? Well, that thought is still there, but there's such a strong need to get the dopamine that you'll often work through those negative consequences. Addiction is a chronic relapsing disease, just like diabetes, asthma, or hypertension. And just like treating those diseases, the way that we need to treat addiction is using evidence-based treatment modalities and consider the social determinants that are coming into the disease. Just like you wouldn't fire a diabetic patient for not being compliant with your treatment recommendations, and we very likely wouldn't fire an asthmatic patient who is smoking, it isn't appropriate to fire a patient who has a substance use disorder for using a substance. and having a relapse. As previously indicated, our treatment modalities involve medication-assisted treatment, cognitive behavioral therapy, family therapy, and in many cases, mutual support groups, such as 12-step groups. The evidence shows that the best treatments for substance use disorders are using the evidence-based modalities of medication-assisted treatment and cognitive behavioral therapy. There's very little evidence to suggest that 12-step groups are beneficial in and of themselves for treatment of substance use disorders. Many patients will find that these are a helpful part of treatment, but unfortunately, they do not separate from placebo as far as a treatment modality. We have many evidence-based treatments for substance use disorders, and that is beyond the scope of this introductory lecture, but I would encourage you to look for additional lectures on the medication-assisted treatments available for substance use disorders, but they're listed here. And in primary care, those that are most commonly used are for alcohol use disorder, and using naltrexone, either as the oral form with a brand name of Revia, or the injectable, which is Vivitrol, is very effective in reducing the amount of alcohol consumed by patients. Acamprosate and Topamax are also very appropriate treatments. Opiate use disorders are incredibly prevalent, and we have very effective treatments available, including buprenorphine, methadone, and naltrexone. Treatment of substance use disorders is best undertaken using a harm reduction perspective, and remembering that treatment is a continuum, not a polarity. It's not an all or nothing sort of thing. We don't look at diabetic treatment as the patient is fully compliant or is a failure. And the same is true with substance use disorders. We need to look at setting small progressive goals to help the patient to improve and overall to reduce the harm and risk, just as we would with diabetic patients by working with them to make small changes in their life in order to bring their blood sugar and their hemoglobin A1C down. Key takeaways from today's presentation. It's important to treat the whole person and to consider the biopsychosocial factors that go into substance use disorders. This also involves understanding that we have evidence-based treatments for substance use disorders. In order to find these, however, we need to screen in our primary care setting. And this is often something that we don't think about, but is very important to ask patients about their substance use, both alcohol and other substances. We're very fortunate within our settings to have behavioral health experts in our BHS social workers that are embedded in our care teams. And they are available to also help to deal with issues of substance use disorders. And for your patients who have more difficult substance use disorders, I would encourage you to use your BHS social worker to bring those difficult cases to the SCR case review, which is done on a weekly basis, so that we can provide some additional insight and input. We are also available through the SCR process in order to talk with you on a one-on-one basis in order to provide additional consultation. If you have any other questions, please feel free to contact me at the Center for Integrative Medicine.